Faster. I need you to count out loud to 30.
13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
30 more.
He's not breathing. It has no pulse. I'm resuming compression.
How many shock cycles have you been through?
Just delivered one shock. We started CPR pretty quickly.
I'm ready to give breaths.
13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Hold on, stop. He just moved. He has an organized rhythm. He has a pulse. And he's breathing now.
Let's get ready to transport.
Come on. I'll get somebody to take you to the hospital.
First, let's talk about the adult chain of survival. There are 5 links in the chain. It starts with immediate recognition of cardiac arrest and activation of the emergency response system. Then it moves to early cardiopulmonary resuscitation, or CPR, with an emphasis on chest compressions. After that, rapid defibrillation is used. The next link in the chain is effective advanced life support that leads finally to integrated post-cardiac arrest care.
And this chain is really a useful metaphor to understand the connection and flow between the stages of emergency cardiovascular care. We just witnessed the chain of survival in action, with the victim seamlessly treated. So now let's go back and review the links in the chain of survival as they happen. The nurse certainly would have preferred to have ideal conditions, but this is an example of working with the conditions in the moment while still making decisions that increase the chance of survival for the victim. As the car pulls into the parking lot, the man in the passenger seat isn't feeling well. The man collapses, and his son realizes that he needs to find help in the doctor's office.
The nurse attends to the victim and recognizes possible cardiac arrest. So she tries to get a response from the victim and sends the son into the office to call for help, to set the emergency response system in motion. The chain of survival begins right here, with the nurse's immediate recognition of possible cardiac arrest and activation of the emergency response system. A rescuer must first recognize that the victim is in cardiac arrest based on unresponsiveness and lack of normal breathing. After recognition, the rescuer should immediately activate the emergency response system and begin CPR. Effective bystander CPR provided immediately after cardiac arrest can double or triple a victim's chance of survival. Bystanders who are not trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR. When an untrained bystander sees an adult suddenly collapse, there are 2 simple steps to follow. Call 911 and push hard and fast in the center of the chest. Dispatchers may provide further instructions and guide the bystander until trained help arrives. Some healthcare providers might find it necessary to provide compression-only CPR until a barrier device is available. The nurse immediately begins chest compressions without delay.
The office assistant summons another nurse from the office to help. The second nurse arrives with the AED. This introduces the next link in the chain of survival. The AED, or Automated External Defibrillator, is a lightweight portable device that can identify an abnormal heart rhythm that needs a shock. The AED can then deliver a shock that can convert a rhythm back to normal. Most sudden cardiac arrests are triggered by abnormal heart rhythms called arrhythmias. A common and treatable arrhythmia causing cardiac arrest is ventricular fibrillation, or VF. With VF, the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain and other vital organs stop abruptly, and the victim loses consciousness. Death usually follows unless a normal heart rhythm and pulse are restored within minutes. The AED uses voice prompts, lights, and on-screen messages to tell the rescuer the steps to take. AEDs are simple to operate, allowing layperson and healthcare providers to attempt defibrillation safely.
The The EMS providers arrive, and they prepare to take over. They extend the chain to give the victim the best chance of survival. Advanced life support can occur in any setting and provides more advanced treatment to the victim.
Once the return of spontaneous circulation, or ROSC, is achieved, the victim is transported to receive post-cardiac arrest care. Post-cardiac arrest care after ROSC focuses on preventing the return of cardiac arrest and on interventions that can improve long-term survival. These 5 links, immediate recognition of cardiac arrest and activation of the emergency response system, early CPR, rapid defibrillation, effective advanced life support, and integrated post-arrest care, show the most important actions needed to treat cardiac arrest. There are slight differences in these links if you're inside the hospital. The first link is surveillance and prevention of cardiac arrest with patient monitoring and assessment by the medical emergency team or rapid response team when a patient's condition is starting to deteriorate. The next link is early activation of the code team, followed by early CPR, early defibrillation, and post-cardiac arrest care. Post-cardiac arrest care may be provided in the cath lab and ICU. Basic life support is the foundation for saving lives after a cardiac arrest. In this course, you'll learn the skills of high-quality CPR for victims of all ages and practice delivery of these skills both as a single rescuer and as a member of a multi-rescuer team. Now, let's go back and review the rescue again, pointing out the steps of basic life support as they happen. First, the nurse assesses the scene quickly to make sure it's safe to approach. She notices the danger of traffic in the parking lot, and by using a bystander in a car to keep the area safe, she begins building a team.
Then she simultaneously checks his breathing and checks for a pulse. If the responder was a lay rescuer and not a healthcare professional, she would not check for a pulse. Lay rescuers should not check for a pulse and should assume that cardiac arrest is present if an adult suddenly collapses or an unresponsive victim is not breathing normally. When she gets no sign of response, no breathing, and no pulse, knowing that EMS is being activated and the AED is on the way, she immediately begins CPR with compressions.
The delivery of rapid, strong compressions is a priority. She'll deliver ventilation as soon as the equipment arrives. Although the nurse detects no breathing here, abnormal breaths are common in the first minutes of cardiac arrest. These abnormal breaths are called agonal gasps and should not be confused with normal breathing. Rescuers can sometimes mistake agonal breathing for normal breathing and fail to recognize cardiac arrest and initiate CPR. We see the nurse start CPR by removing the victim's shirt and giving chest compressions. You can see that she places the heel of one hand on the center of the chest, just over the lower half of the sternum or breastbone. Then she places the heel of her other hand on top of the first. And she keeps her shoulders right over her hands for leverage, with her elbows straight.
Critical characteristics of adult high-quality CPR are to push hard and fast at a compression rate of 100 to 120 per minute and a depth of at least 2 inches or 5 centimeters. Allow complete chest recoil after each compression and minimize interruptions in compressions to less than 10 seconds. There is some evidence that compressions that are too deep, more than 2.4 inches or 6 centimeters, can increase injuries from CPR. However, most providers do not perform compressions deep enough. You should focus on making sure your compressions are at least 2 inches or 5 centimeters deep. We recommend the use of feedback devices to ensure that your compressions are the correct depth. We'll talk about feedback devices later. The nurse just focuses on providing high-quality chest compressions while EMS is being activated and the AED is being retrieved.
And as you can see, giving compressions requires intense effort. You'll discover this in a few minutes when we practice chest compressions.
The first nurse continues with CPR, including ventilation with the pocket mask, as the second nurse shaves the victim's chest. This ensures that the AED pads have direct contact with skin. Otherwise, if the pads had difficulty sticking to the victim's skin, the AED would be unable to analyze the victim's heart rhythm. In that case, the AED would give a message to check pads.
The office assistant also comes out, still on the phone with EMS dispatch. Dispatch will want to keep the rescuer on the phone to provide guidance, update EMS with the victim's condition,